that I would normally do for the chapter. This week our chapter is on the mental disorders, and so in this lecture this video I'm just going to highlight a couple of things that I think that are important. Mental health issues, mental health conditions, they're a very interesting area in healthcare, and this is the only section that I'm going to tell you not to dig around in the chart to find or figure out diagnoses, because mental health diagnoses can be vague in regards to their symptomatology. And so you will just be going by what the healthcare provider says is the condition. Code that and don't review the documentation because it's too hard to single out the documentation, or to single out the diagnosis. So that's one of the really important things that you need to remember about this section. Organic brain syndrome, just a little note on this. When coding organic brain syndrome, you first need to identify if the condition is a psychotic or non-psychotic organic brain syndrome. If this is not provided within the documentation, make sure you ask the healthcare provider. Never, ever, ever make any assumptions based on the documentation. In terms of dementia, dementia is usually caused by another condition. In other words, the result of another condition. So when you use a dementia code, make sure that you code the condition, if there is anything listed that is causing the dementia first, and then you do the dementia code. So for example, Alzheimer's disease with dementia. That would be coded with the Alzheimer's code first and then the dementia. And just a little side note, dementia and Alzheimer's are sometimes used interchangeably by the general public, but these are two separate conditions. Also in a dementia code, there is a 5th digit that you need to use, and that indicates whether there's a behavioral disturbance such as combativeness or something like that. So you're going to need to look in the documentation regarding that as well. For schizophrenic disorders, just wanted to point out that the 4th digit on that indicates the type of schizophrenia. And again, all of that needs to be documented and provided by the healthcare provider before it can be coded. Non-psychotic, I'm trying to find my notes here. Non-psychotic mental disorders. I don't have anything more to say about that. They're just those are kind of vague disorders, so it kind of makes them intriguing. Substance abuse. There are unique codes for both alcohol and drug use, and there's specific codes for alcohol and drug abuse and dependence, so you need to be very careful to review the documentation that's there. History of drug or alcohol dependence is coded as in remission. And just so you know that there's further combination codes for drug and alcohol use and associated conditions, such as withdrawal, sleep disorders, psychosis, that kind of stuff. There is also a blood alcohol level code that you can use if a patient comes in an intoxicated state and you know their blood alcohol level. There's a code for that as well. But again, you need to make sure that the documentation is there. And talking about withdrawals from alcohol, drug or drug dependence, those are some very, very serious conditions. And there's many different symptoms that a person can have when they're dependent on these drugs, and especially when they are coming off of those drugs, the symptoms that they can have and the things that can happen to them are extremely serious. An important part of this section is to make sure that you look in the alphabetic index when you're coding drug and alcohol dependence, and read any of the notes that are around there just to make sure that you're getting everything you need to in there. When talking about the principal diagnosis in this chapter, we already defined when a code is considered a principal diagnosis in previous chapters. However, there is a disclaimer in this chapter regarding specific instances where there are other rules. And so instead of the principal diagnosis being the condition found after study with substance abuse or dependence, the principal diagnosis is going to be based on the circumstances of the admission. So that's just a little important note to know in regards to that. We should talk about the difference between detoxification and rehabilitation. With detoxification, the patient is coming in a state of intoxication. They are already under the influence of the drug or alcohol, and they are coming in to a hospital setting, usually to get off of those drugs or the alcohol. And during that time, as the detoxification time, is a very hard time because they have to use other drugs to kind of combat the things that can happen, hallucinations and all kinds of stuff that can happen during the detox process. Rehabilitation is what happens after that detox process, where they're off of everything, and you're kind of looking at an AA type situation where you're rehabilitating them and getting them back to a state of from previously being under alcohol or drug abuse. I believe that's it. Looking at my notes, just making sure that I've covered everything that I wanted to cover. I'm pretty new to this whole video thing, so if I didn't explain something quite right, or if you still have questions, please make sure to ask in the virtual office. Otherwise, I hope you have a good day, and talk to you later.